The Quotient ADHD system is an FDA-cleared device for the objective measurement of hyperactivity, impulsivity, and inattention as an aid in the assessment of ADHD. This video demonstrates how to set up and run a test, how to upload the data to the server, and how to download reports. To set up the test, enter the patient demographics, any medications they may be taking, as well as diagnostic information. Once data is entered into the computer, position the headband with the infrared reflector on the patient's forehead. If the patient is 13 years or older, you will place additional reflectors on their shins so leg motion can be measured. Next, adjust the height of the stool and, if necessary, the motion tracking system so the reflector lines up inside the target box. Adjust the leg reflectors so that they are 13 inches from the floor, and verify that they too line up correctly inside the target boxes. Once the targets are set, explain to the patient how the test works. Children ages 6 to 14 will be using a 2-star test. With this test, the youngster presses the space bar each time they see an 8-pointed star on the screen. They are to do nothing when the 5-pointed star appears. For adolescents and adults, 3 targets and 1 non-target are used. Here, the stars will appear at variable intervals. The patient is to press the spacebar when they see 5, 8, or 16 pointed stars, and let the 4-pointed star pass. It is a good idea to run the short, optional pre-test to ensure the patient understands the instructions. Although they will hear audio dings in the practice test, sound is not present in the actual test. After the practice run, begin the live test. This will take 15 minutes for children 14 or under, and 20 minutes for adolescents and adults. As the patient responds to the stars on the screen, the infrared motion tracking system records the movements of the reflectors. Measurements are taken 50 times per second. The system collects data on the person's ability to sit still and respond accurately to the changing stimuli on the screen. Although it sounds simple, responding quickly and correctly requires focus and attention. When the test is complete, simply upload the data to the Biobehavioral Diagnostics server. Click on Submit a Test. Enter your username and password. Click on the test you want to upload and click Submit. This process takes just a minute. You can download patient reports from any computer with internet access. Log in to the clinician portal by typing the address seen here. Enter your username and password. Next, click on the Previous Reports link. Find the patient report. You can sort by date or the patient's last name. Then, click on the PDF link to download the file and print it in color, or click on the HTML link to view the report on screen. Review the data on motion, attention task, and attention state shift, and the index and scaled scores in the context of your clinical exam and other assessment tools for ADHD. In summary, the Quotient ADHD system provides accurate, objective information to aid in the assessment of ADHD. The objective reports will help guide decisions both at baseline and at follow-up visits and should improve efficiency in your practice.